Hello, my name is Dr. Jeff Dodge. I'm the president of the Rhode Island Oral Health Foundation. First of all, I would like to thank you for taking the opportunity to volunteer and help us at our annual Mission of Mercy free dental clinic. I'm just going to go over a few basic points that I think might help you to have more fun over the weekend, enjoy yourself a little bit more, and feel a little renewed sense of giving back when you leave. First of all, to start out with, this year we have set a relatively ambitious goal of 1,000 patients. The first year we saw slightly over 800. This past year we saw 925. This year we're shooting for 1,000. Of course, that's dependent on the procedures that come in and the patients that come in, but it just gives us something to shoot for. I'd like one thing for you to keep in mind throughout your service to us, whatever shift you're on, whatever you may be doing. It's kind of a mission mentality. This is not really a private practice setting. We don't have all the ideal pieces of equipment right at our fingertips where we'd like them. We don't have necessarily everything just the way we want it. We're here to provide a service. We're trying to help as many people as we can with some definitive dentistry. So try to keep that in the back of your mind. Be very flexible. Understand that other volunteers around you might be doing things they don't normally do. So try to cut people a little bit of slack. They're working outside of their comfort zone. Just have patience. Try to be patient with everyone. Everyone will be patient with you. We're sort of setting out to have kind of a one and done mentality. That being said, it's kind of a soft one and done. And just as an example, there might be 2 root tips remaining next to each other. We're obviously not going to really take out one root tip and send the patient along. We'll try to take out both of those root tips. Use your clinical judgment, use your discretion, whatever you feel is within your comfort zone to do to help that patient, within a reasonable period of time, go for it. Remember too that when the patients come in, some of them have been waiting quite a while, especially as we get into the afternoon hours. Some have been in line outside, some have been overnight. Just try to take 2 or 3 seconds, just, get to know the patient a little bit, greet them when they come in. Just remember that, as someone much wiser than I said, it's all about what we are doing for the patient, not what we are doing to the patient. So try to keep that in the back of your mind. Be prepared that the patients may be anxious. Take a couple of minutes, calm them down, just reassure them. It's a lot of work for some of these patients to come and see us here. We want to do everything we can to make that smooth for them, make that procedure we do very smooth. If there's any issues, communicate with your leads. You'll notice the clinical leads are wearing blue scrubs, easily identifiable. The clinic area is relatively small. There'll always be a lead somewhere. There'll be someone that you can get some help from. Feel free to ask any of us at any time. That's what we're all here for. Working together makes the project go smoothly. Just a couple of other little items to keep in the back of your mind. Hey, take a break every now and then. We have people to fill in. Get up, stretch your legs, get a glass of water, go down and get some coffee, get a snack. Keep yourself, up and around, moving. We don't really expect you to sit attached to that chair for an extended period of time. Certainly we want you to be comfortable, so get up, walk around. We have plenty of snacks available. Make sure also that from a safety standpoint, you know where the nearest exit is. We hope we won't have any emergencies, but should something arise, you will be in charge of directing your patient to that exit and out the door. And if something happens where we have to leave the building quickly, we'd like you to take the patient you're working with, get them out of the building, and stay out there with them, just so we know where everyone is, we know everyone's taken care of. We try to have the patients escorted wherever they go. Once your procedure is finished, the patient doesn't just pop up and shoot off at their leisure. Make sure you have someone, an escort, to take them to their next station, whatever it might be. We don't ever have patients running around unattended. The big thing is to enjoy yourself. Have a good time. The patients that you see over the course of your time with us will be very appreciative of what you're doing for them. You'll leave after this weekend, at least we hope you will, with a renewed sense of enjoyment for dentistry. And that's our whole goal too. So please come, have a great time, enjoy yourself. Anything you think of that might be helpful to us moving forward, please pass it on. Enjoy.